Thank you, Adam, for this introduction. I'm happy to be able to present our abstract entitled Patient-Reported Outcomes in Adults with Congenital Heart Disease who recovered after hospitalization. And this is a sub-study from Approach-IS. It's a large project representing the assessment of patterns of patient-reported outcomes in adults with congenital heart disease international study. I'm representing the Approach-IS consortium, and I really want to acknowledge all the co-workers in this group. The main aim of this sub-study was to compare patient-reported outcomes in adults with congenital heart disease who had versus had not been hospitalized during the previous 12 months. And the bottom line behind this research question was that you can assume that people who are in a stable situation, who are in a stable condition and just come to your outpatient clinic for a regular outpatient visit, that they are doing better in terms of patient-reported outcomes compared to people who recently had acute health challenges. And it was not as much the question if there is a difference between the two groups, but rather how big is this difference. You may know that Approach-IS is a cross-sectional observational study that was conducted in 24 centers from 15 countries in 5 continents, and overall more than 4,000 patients have been included. Patient-reported outcomes were measured using different questionnaires, such as the SF-12 health survey, and this resulted in a physical component summary and a mental component summary. We also used the EQ 5D visual analog scale to have an indication on self-reported health. Psychological functioning was measured using the Hospital Anxiety and Depression scale with both an anxiety and a depression dimension. And quality of life was assessed using a linear analog scale and the satisfaction with life scale. Overall, 17% of this cohort indicated to be admitted in the hospital over the past 12 months. And I have to admit that we do not have data on how long ago they have been admitted. Some patients might have been hospitalized a few weeks ago, whereas others, literally, it could take more than 12 months ago. And this is how the results look like. We calculated mean standardized differences, and the scores of the people that have been hospitalized are indicated here and compared to the people who did not underwent an hospitalization, representing the null, the 0 line. And as you can see, consistently patients who have a hospitalization scored lower, scored worse on the patient-reported outcomes than people who did not have hospitalization. For the physical component summary, mental component summary, and the EQ visual analog scale, the scores are lower. There is a higher score on anxiety and depression and lower on quality of life and satisfaction with life. All these differences were statistically significant, but more importantly, the effect size. We calculated the Cohen's d, indeed, and except for anxiety, all the Cohen's d's were larger than 0.2. This suggests that the difference between the groups is small, but not negligible. So in conclusion, we can state that adults with congenital heart disease who had an hospitalization in the past year report worse outcomes on several patient-reported outcomes. And this is important for researchers because the timing of the recruitment of patients and the place of recruitment may also shape the results that we have. If we are recruiting patients in conjunction with an hospitalization, we might tend to have worse outcomes than we are recruiting patients during regular outpatient clinic visits. Thank you so much.